Hello, my name is James Chajari, and I'm the Executive Director at Legal Assistance for Seniors. It is my honor to welcome you to today's program, Towards a More Just, Less Ageist Society, and Elder Justice Agenda, presented by Lisa Nerenberg, Executive Director of the California Elder Justice Coalition. This is the first in our series of 4 webinars addressing various topics on elder abuse. As you all probably know, when we hold the conference in person, it takes many dedicated people and agencies coming together to produce such a large function. And this webinar series is no different. First, I would like to thank all of our sponsors who continue to support us through this transition to online education. Their continued dedication and excitement for the work we do is amazing. In particular, I'd like to thank our 4 top sponsors: Michael Stevens, Probate and Trust Realtor, our diamond sponsor; Campbell Green, our platinum sponsor; and our 2 gold sponsors, the Tile Shop and Acuna Wrigley. Michael Stevens has been an incredible support to LAS and is always there to help with enthusiasm. If it involves supporting older adults, Michael is always there with a big yes, and how can I help? Campbell Green has been with LAS long before I came on board. For anything big or small, Philip Campbell is always helping LAS, from emceeing events to guiding the agency by volunteering to be board president. Phil believes in older adults and in LAS. The Tile Shop and Acuna Wrigley, our gold sponsors, have been supporting LAS's work around preventing elder abuse for many years. They are always there to support this work, and we really are so appreciative that they continue to believe in the importance and value of preventing and stopping elder abuse. We have a whole host of sponsors at the silver and bronze levels that we are so incredibly grateful for. Many of these sponsors have been supporting this work for many years. They are our collaborators and our partners, and they keep us excited to continue to do this work. At the silver level, we have Anderson, Yazdi, Wang, Minton, and Horn; Fiduciary Accounting Services, IMT Associates, and Mechanics Bank. At the bronze level, we have 21st Century Care Solutions, ARM Homes, Center for Elders Independence, Evans Law Firm, Farmers Insurance, Golden Gate Fiduciary Services, John Balquist Fiduciary Services, the Law Offices of Sonoy Rousseau, Merlander Company, the Professional Fiduciary Association of California, and Alameda County Supervisor Wilma Chan. In addition, Golden Gate University was going to host the conference in May, and while that did not happen for obvious reasons, they have continued to support LAS in this webinar series with technical support and serving as the honorary event host. The Institute on Aging and their amazing staff continue to be wonderful partners in providing continuing education units for a wide variety of professionals. Last but not least is the team that contributed their time and hard work over the past several months to transition an in-person conference to an online experience. Greg Bedard, Katie Brady, the entire LAS staff, and our event producer, Becca Bloom from BB Events, and Gracie Quinn from Golden Gate University. As I'm sure you're aware, today's presentation is part of a series of 4 webinars LAS is producing in the coming weeks. They are all free of charge and open to the public, though a donation of $25 per webinar will be greatly appreciated and accepted in order to support our ongoing work. We hope you find these presentations informative and useful. You can register for these webinars by visiting our website at lashighcap.org. That's LASHICAP.org, and going to events. Thank you again for joining us, and I hope you enjoy the program.
Good afternoon. My name is Jenny Pardini, and I am the Community Education Advocate with Legal Assistance for Seniors. I'm delighted to be your moderator for this webinar. Today you will hear a 1-hour educational presentation from our guest speaker, followed by a Q&A that I will be moderating. If you have any questions for our speaker, please submit them at any point during the program by clicking on the Q&A icon at the bottom of the meeting screen. If you have any technical issues, you can ask us in the chat and our technical team will do their best to assist you. All right, let's get to it. It is my pleasure to introduce you to today's speaker, Lisa Nerenberg, Executive Director of the California Elder Justice Coalition, to share her knowledge on ageism in society. As part of her leadership of CEJC since 2009, Lisa works to shape elder justice policy through her oversight of a multi-agency and multidisciplinary coalition. She has served as an instructor at the City College of San Francisco since 2004, teaching courses on such subjects as health and aging and elder abuse. With more than 35 years as an advocate in the elder justice movement, Lisa has helped to draw attention to ageism in society, as well as to elder abuse as a public health concern. Her recent book, Elder Justice, Ageism, and Elder Abuse, comes just in time for what's been called the civil rights movement of our time. It provides ways to think about our work in aging services through the lens of human rights and social justice. Lisa, welcome to the program.
Hi, everyone. It's really a pleasure to be here today. Although I have to say I'm a little disappointed that we didn't get to meet in person. I've been to a number of LAS conferences in the past, and I know they've always been exceptional. And in these really trying times, I think we could all use a good dose of the energy and inspiration that we get from being together. So hopefully that'll happen again next year. I really want to thank Jim and Katie and everyone else who was involved in putting this series together. It's really an honor and a privilege to be able to come to you today and to talk about my new book. When I started writing Elder Justice, Ageism, and Elder Abuse, I couldn't have imagined that so soon after it came out, we'd be at this inflection point where it seems like just about everybody is talking about elder justice. But I do feel fortunate that it turned out that way, because I think older people and their allies and their ally advocates really have an enormous amount to contribute to the dialogue today. And so I hope that maybe my comments today will encourage some of you to do that and suggest ways of doing that. So when I started writing the book, it had been about 10 years since I wrote my first book on elder abuse. And in that book, I talked about how the field had developed up until that time. But in those intervening 10 years, a lot happened, both in my own life and in the history of the field. On the personal front, I joined the ranks of older Americans, I'm proud to say. One by one, I crossed all of those thresholds. First, I was eligible for early bird specials, and then it was Medicare and Social Security. And suddenly the they that I've been talking about all these years became we and us. I'm still having a little trouble with those pronouns. During that time, I also helped start the California Elder Justice Coalition, along with some other colleagues who'd been working in the field of elder abuse prevention. And we'd realized that to really have an impact in elder justice, we really needed to be addressing it from a policy perspective as well as from a practice perspective. And so we formed CEJC to provide a voice from the field for elder abuse. It's really been a wonderful experience. I've had a chance to work with a really dynamic group of innovators, and we've all really learned a lot from each other. And if you want to learn more about CEJC, you can find us on our website at elderjustice.org or follow us on Twitter at elderjusticecal. So I hope you'll consider joining us or supporting our work. I also, during those 10 intervening years, started teaching classes in gerontology and ageism and elder abuse at City College of San Francisco. And for those of you who've ever had the experience of teaching, you know that it's really hands down the best way of learning yourself. Not only do your students challenge you at every turn, but when you realize the awesome responsibility that you have, I think it really makes you start challenging your own assumptions and beliefs. So during those 10 years, the field of elder abuse also changed significantly. And over the years, elder abuse, back from the beginning of the field, which goes back to the early 1980s, elder abuse was framed and reframed multiple times. It's been called a medical syndrome. It's been called the flip side of child abuse, a variation of domestic violence, a caregiving issue. But then in the early 2000s, it was reframed again as a matter of justice. And can I have my first slide? The Elder Justice Act of 2010 was our first federal legislation on elder abuse. And it explicitly says that older people have the right to live free from abuse, neglect, and exploitation. And so this reframing of abuse or freedom from it as a right seemed right, but it also seemed incomplete. Because to me, elder justice means more than just elder abuse prevention. It's about human rights and fairness, autonomy and independence. And these were issues that we were also dealing with in elder abuse prevention. What I sometimes think of as our original sin in elder abuse is that when states started developing their programs back in the early 1980s, they patterned their responses after programs that had been developed a couple of decades earlier for child abuse. And the assumption was that older people, like kids, weren't able or willing to come forward to ask for help on their own. And so we mandated third parties to report abuse to public agencies that would then come out and do investigations. So with kids, it was pediatricians, daycare workers, teachers, and with older people, mandated reporters are really just about anybody that works with older people. And that list of mandated reporters keeps getting larger. Just recently, we included investment advisors and brokers to the list of people that have to report elder abuse. And while it has clearly helped countless people, it's also led to accusations of paternalism and ageism that we've never really been able to shake. And so it seemed to me that reframing elder abuse as a right provided us with an unprecedented opportunity to reevaluate what we were doing through the lens of social justice and human rights. Next slide. So for those of us who grow up in this country, I think we take it for granted that we know what justice means. We memorize lines from the Declaration of Independence. We pledge allegiance to a flag that we're told stands for liberty and justice for all. And of course, there's Superman's oath to truth, justice, and the American way. And like so many people today, I went back to really try to understand what the founders meant by justice and what it means today, particularly for older people. And so I started with the basics, the right to life, liberty, and the pursuit of happiness. Next slide. So the right to life never made it into law, although the term's been appropriated, and I think rather brilliantly, to refer to the rights of the unborn by those who are opposed to abortion. It's really a lot harder to find definitions of the right to life after birth. But here's one that I think is really a great starting point for elder justice. And it comes from a philosopher, Martha Nussbaum, who defines it this way. She says that the right to life is being able to live a life of normal length, not dying prematurely, or before one's life is so reduced as to be not worth living. And she goes on to say that in free societies, people have to be adequately nourished, sheltered, and protected from assault to function. Next slide. I think her definition is particularly poignant if you consider that in the United States, the richest men live an average of 15 years longer than the poorest. And for women, that difference is 10 years. Or that nearly 50% of low-income adults have disabilities compared to just under 11% for adults overall. And African Americans are twice as likely to develop dementias, and for Hispanics, it's about 1.5 times as likely. And so I think that Nussbaum's definition forces us to ask why the right to life is so much farther out of reach for some Americans than it is for others. Next slide. So while happiness, or the right to pursue it, didn't make it into law in this country, it did in Bhutan, where it's not only a national goal, but they actually have a measure of gross national happiness. And you can see these are the 4 pillars of happiness that go into that equation. It's equitable socioeconomic development, good governance, and the preservation of culture and the environment. And I really think of these pillars as being prerequisites for elder justice, because you really can't have justice if you don't have good governance and respect for diverse populations and for the planet. Next slide. To understand what the founders meant by liberty, you really need to put it in context. So our founders had just rejected a monarchy, and they were really afraid of slipping back into one. They really worried about government overreach. And here's how Jefferson described liberty. He describes it as what the people are entitled to against every government on earth, and what no government should refuse. So essentially, the founders were defending people's right to be left alone, their freedom. And they made it clear that when the government restricts freedom, it has to have compelling reasons for doing so. And that compelling reason has to be the common good. That's the standard. There also has to be due process. When people's rights are denied or restricted, they're entitled to due process. Of course, these rights only applied to a few people back then, and we've been arguing about who they apply to and how ever since. But I think this way of defining liberty is particularly important when we're talking about older people, because there's a tendency, I think, to want to restrict older people's freedom as we get older. And it's often well-intended. Family members may see that mom and dad are starting to have problems, and they think that they'd be better off in a more protected environment. And certainly in elder abuse, we're constantly trying to balance freedom versus safety when they're in conflict, which happens a fair amount of the time. Next slide. So the term justice also has a lot of meanings. There's our justice system, which was designed to protect ourselves not just from the government, but from each other. And today, as people are talking about reimagining law enforcement, some people in our field are starting to raise questions about the role of police in elder abuse prevention, for example. They're asking, are we demanding too much from law enforcement or too little? Others are asking about the civil system. How fair are our civil courts, especially as it pertains to things like conservatorship and civil lawsuits? So in other words, they're asking just how just is our justice system. Next slide. So justice is also about fairness and equity. Distributive justice is fairness in how societies distribute resources and opportunities among their members. And intergenerational justice is how we share resources between the young and the old. And a lot of what we call aging policy in this country actually advanced these forms of justice. For example, Social Security was created during the Great Depression when a lot of people of all ages were poor, but poverty rates for older people were particularly high. And so Social Security helped level the playing field, at least to some extent, between the rich and the poor and the young and the old. The same is true for the Older Americans Act and for Medicare. And Medicare also advanced racial justice. Hospitals weren't eligible for Medicare if they discriminated against Black doctors or patients, and that was true of other Medicare-funded programs. Next slide. Another major milestone in elder justice was the Supreme Court's Olmstead decision, which didn't actually even involve older people. Now, this year, we're celebrating the 30th anniversary of the Americans with Disabilities Act, which established that people with disabilities have a right to reasonable accommodation. And for the most part, it referred to reasonable accommodation in the workplace or in public spaces. But then in the late 1990s, attorneys representing these two women who had mental disabilities and were living in a state-run institution made the case that their clients were capable of living in the community with reasonable accommodation, and that failing to provide that accommodation in the community deprived them of their rights under the Americans with Disabilities Act. And courts later ruled that Olmstead also applied to skilled nursing facilities and even to people living in the community who were at risk of nursing home placement. So Olmstead has really had an enormous impact, because before that time, people were already making the case that older people should be able to receive care in their homes because that's what they want, or in many cases it's because that's what's less expensive. But Olmsted actually established it as a right. Next slide. So individual rights are also addressed in international law. And after World War II, world leaders came together to create the United Nations with the goal of trying to prevent the unspeakable abuses of power that the world had just witnessed. They also crafted the Universal Declaration of Human Rights, which contains 30 rights and freedoms that all countries are asked to sign on to. Next slide. The United Nations is a large, complicated organization that has a lot of moving parts, but programs that address older people and aging fall into one of these categories: human rights, public health, or as a matter of social development. So human rights has always been central to the United Nations missions, but while the Universal Declaration of Human Rights applies to everyone, it wasn't long before groups started asking for special protections, and that led to the development of conventions. Next slide. In international law, conventions are agreements between countries to recognize certain rights, and there are currently 7 that you can see cover a broad range of groups. As you can also see, there isn't a convention for the rights of older people, but a couple of the existing conventions do mention older people. For example, the Convention for Women mentions discrimination in some countries' inheritance laws that disadvantage older women. When men die, their assets go to their sons, which may leave the older surviving spouses destitute or dependent. And even the Convention Against Torture and Cruel Treatment describes restraints in nursing homes and withholding pain medication. There's an active movement now to create an international convention for older people. One of the people that I interviewed for the book was Charlie Sabatino, who's with the Commission on Law and Aging at the American Bar Association, who's been actively involved in that movement to create a convention for the rights of older people. And he talked about the importance of American advocates participating in these international efforts. Even though conventions aren't binding, they have significantly influenced policy in the United States. And one example that he used was supported decision-making, which is described in the conventions, and it's actually been added to state laws here in the United States. The United Nations approach to public health is directed through the World Health Organization, and the approach is similar to ours in the United States, which I'm going to talk about in a few minutes. So I want to move on to the next one, the United Nations Social Development Programs. Next slide. So the social development programs focus on democracy building, and they draw attention to underserved groups, particularly in developing countries. And the United Nations has an extremely ambitious plan for social development that's called the Sustainable Development Plan. And here you can see some of the goals. They include to eliminate poverty, inequality, environmental degradation, to achieve prosperity, peace, and justice, all by 2030. And that's because we missed the original goal, which was 2015. So there are a number of groups that are actively working today to try to ensure that older people have a voice in the Sustainable Development Plan. And one way of doing that is through what's called mainstreaming, which refers to making sure that the interests and needs of particular groups are included in plans for all mainstream issues. So Susan Summers, who's active in the United Nations, some of these initiatives, told me how she and her colleagues go to forums on a variety of topics, and they're constantly jumping in to ask, what about older people? I think it's something that we need to be doing, not just in the international arena, but also here at home, because it's hard to imagine just about any public policy that doesn't affect older people, whether it's immigration, climate change, cybersecurity, hunger, criminal justice reform, all of those things are going to significantly affect older people. Next slide. So another way of looking at elder justice is through the lens of ageism. I used to teach a class on ageism at the college, and every semester I started out by asking my class what they thought ageism was about. And without fail, somebody always brought up the Golden Girls. I think it's become almost a cult thing in this country. And so we get into discussions about whether the girls portrayed older women in a positive light or a negative one. Were they good for the cause? Were they bad? And it's true that how we portray older people in the media is important. I think it shapes how we think about older people, and it shapes how we think about our own aging. But Robert Butler, who's shown in the slide, is the Pulitzer Prize-winning geriatrician who coined the term, and he clearly saw ageism from a broader perspective as a human rights issue. The first time he used the term publicly, ageism, was in an interview with a young Washington Post reporter whose name I'm sure a lot of you will recognize, Carl Bernstein of Watergate fame. And the interview was about a proposed public housing project in Chevy Chase, Maryland. Some of the neighbors were opposed to the project, and so they took to the streets in protest. And a number of civil rights activists got involved because they assumed that it was racism that was driving the opposition, that the neighbors were afraid that the new housing would bring in people of color and poor people into the neighborhood. But Butler contended that it wasn't racism, but rather ageism that was fueling the protests. And he's quoted in the article as saying that it was the prospect of old people with canes and walkers cluttering up the neighborhood that they were afraid of. Next slide. So Butler went on to found the International Longevity Center, and they produced a report card that looked at these 7 metrics of ageism. And you can actually think of ageism as the motive behind the individual acts in these categories, like individual acts of elder abuse or individual acts of discrimination. But Butler and his colleagues were really more interested in institutional ageism, or how ageism is baked into our systems. He believed, for example, that it's ageism that accounts for the lack of attention and resources that we've devoted to elder abuse prevention. And they also saw ageism in how our healthcare system treats old age as a disease rather than as a natural process. They saw ageism in the fact that our laws and regulations for nursing homes didn't really have much teeth, or that they weren't enforced aggressively. We also know that in disaster after disaster, older people are still often the last ones rescued, even though we have made some progress in that area. We know that discrimination is rampant in the workplace, despite the fact that age is included in anti-discrimination laws. You know, when Mark Zuckerberg famously said that young people are just smarter, he wasn't alone. And ageism is certainly alive and well in Silicon Valley. They've just got sneakier in the ways that they discriminate. Butler and his colleagues also saw age bias in the media and in marketing. Next slide. So this is Maggie Kuhn, who founded the Grey Panthers. And the Panthers picked up the banner of anti-ageism. And they also saw themselves, though, as part of the larger social justice movement of the 1970s. They aligned themselves with advocates for racial justice, for women's rights, gay and lesbian rights, and they even marched against the war in Vietnam. I was really disappointed to learn that just a few years ago, the National Grey Panthers organization disbanded, although I know that there are still a lot of very active chapters at the state and local level that are doing great work. Next slide. But the idea of ageism being on par with the other isms never really caught on. And Ashton Applewhite, who's a popular figure in ageism, has suggested that it's because people just don't have the bandwidth for another ism. And it was researchers at the Frameworks, at the Frameworks Institute, which is a communications firm that's been doing a lot of exploring attitudes about age and ageism offer this rather harsh critique. They say Americans are more likely to rely on little picture explanations that reduce the problem of ageism to the everyday interactions of a few outlier individuals with ill will in their hearts. And I have to confess that when I started teaching ageism at City College, I was a little bit wary of equating ageism with the other isms. The course that I taught was offered through the school's social justice certificate program, along with courses in racism and sexism, anti-Islam and anti-Semitism, ableism and classism. And I just wasn't sure that students would see ageism as being as important as these other issues that they felt so passionate about, or that they'd see it as being in competition. Next slide. But in all the social justice classes, we talked about intersectionality, which is the collective impact of the isms. And in aging, we also talk about double and triple jeopardy, which is also about the combined impact of age, race, gender, or the different forms of discrimination that people have experienced. We also talk about cumulative disadvantage, which is the impact of the isms over time. And so if you look at it this way, I think age isn't just a basis for injustice, it's a compounder of other injustices. And that's a perspective that I think enriches our understanding of social justice. And it really resonated, I think, with my students. Next slide. Another development that laid the groundwork for elder justice was the infusion of public health into aging and elder abuse. Over the last few decades, we've seen public health approaches being applied to a wide range of issues, from fall prevention to Alzheimer's disease and other chronic conditions. And in the early 2000s, CDC, the Center for Disease Control and Prevention, declared elder abuse a public health issue. I think today the public is getting a crash course in public health, but I worry a little that they're getting kind of a distorted view. Public health isn't just about things like lockdowns and masks and social distancing. It's true that that public health has always focused on diseases. It actually got started during a cholera epidemic back in the 1850s in London. And back then, an observant doctor named John Snow noticed that a lot of the cholera patients that he was treating got their water from the same well on Broad Street. And so he checked out his hunch by going door to door, asking if anyone in the household was sick and where they got their water from. He concluded that households that got their water from Broad Street were more likely to get sick. So he was able to get the city leaders to take the handle off the pump, thereby stopping the outbreak and launching a whole new field. When I talk to my aging classes about public health, I usually stop at this point and I ask them, why was this such a big deal? A guy takes a handle off a pump, and here we are talking about it nearly over a century and a half later. I think most of the students understand that his actions kept people from getting sick in the first place, and prevention is really paramount in elder justice or in public health. It eliminated countless suffering and loss. And they also recognized that it wasn't just wealthy people who benefited, that anyone who lived in that community was then protected. But Snow's, next slide. Snow's discovery actually did a lot more than that. For one thing, it set the stage for epidemiology. And unlike medical research, which looks for the causes of diseases, epidemiology looks at the characteristics of people who get sick, and it tries to figure out what they have in common. So that may be behaviors like drinking water from the same well. It could be smoking or unprotected sex. It can be characteristics like gender or race, or even where people live and work. I think what's important is that these common factors are called risk factors and predictors. Some of them can be modified and others can't. But epidemiology, in epidemiology, you can begin to address problems even if you don't know the exact cause. So in cholera is actually caused by a bacterium, which wasn't identified until about 30 years after Snow's intervention. But over the years, public health has really expanded its focus. It went beyond diseases to address a whole range of social issues, things like drunk driving, gun violence, climate change, social issues that really have a devastating impact on the public's health. And a major focus in public health over the last couple of decades has been finding out why some people live longer than others and why they're healthier. And what they've discovered is that some of the strongest predictors of early death and disability aren't individual factors at all, or behaviors or genetic factors. They're social factors like income and social status, education, literacy, childhood experience, and these are called social determinants. And I know we're hearing that expression a lot these days, but it's been around in public health for many, many years. And so today we know that social determinants are associated with a broad range of both health and social problems. And while we don't exactly understand the cause and effect relationships between these factors, we're finding out who's at greatest risk, and that can point the way to interventions and more research that's going to help us in the future. Every 10 years, CDC issues a 10-year plan, and in the last 2 cycles, equity and justice were actually considered public health goals. So they're very much part of public health. This next slide is a quote from Martin Luther King. Here's what he had to say about health justice. Of all the forms of inequality, injustice in health is the most shocking and inhuman. And so I think health justice really needs to be a prominent part of elder justice. Next slide. Public health also offers us a lot of great tools, and that includes the ecological model, which isn't unique to public health, but it's used a lot in the field. And it looks at problems at 4 different levels: individual, interpersonal, community, and societal. And it also offers interventions at each of these levels. The ecological model isn't impartial. It favors community and societal problems and interventions because they affect most people. Next slide. Public health also offers a continuum for prevention. Primary prevention is preventing problems from occurring in the first place, and that's usually done by reducing risk factors where that's possible. And it's considered the gold standard because, as I mentioned earlier, it prevents people from experiencing the problems. Secondary prevention is catching problems early on when they're easier to stop or reverse. And that's usually done through things like screening or checkups, or really just being vigilant, watching for risk factors. Tertiary prevention comes in after problems have occurred, where the focus is on reducing the harm. And again, public health isn't impartial. It prioritizes primary prevention. Next slide. So when I was writing Elder Justice, Ageism, and Elder Abuse, I wanted to go beyond just describing some of these ideas and developments that led to where we are today in the way we think about elder justice. I wanted to try to organize them in a way that would give us a big picture and that would help us see how we're doing now, where we want to be, and how we get there. And it seemed to me that these public health frameworks could help us get started. And so I came up with the ecological model of elder justice, where at the individual level, the focus is on protecting individual rights. At the interpersonal or relationship level, it's about abuses of power and preventing abuses of power. At the community level, it's about equity and fairness, both within communities and between communities. And at the societal level, it's institutionalizing elder justice in public policy and public opinion. Next slide. It also incorporates the 3 types of prevention. So we can actively promote elder justice, we can identify threats to elder justice and try to combat them, And if that fails, we can try to restore justice and repair the harm. Next slide. So what are individual rights? Obviously, they start with the constitutional freedoms and civil rights that we're familiar with, the right to free speech, to religion, privacy, the right to assemble, the right to due process. It's also protections against discrimination based on age and race and gender identity and functional ability. That includes discrimination in the workplace and in housing and in healthcare and in lending and public benefits. It includes the right to reasonable accommodation under the Americans with Disability Act. But some older people have additional rights that are often ignored or overlooked. And that includes, for example, the rights of consumers, crime victims, and the incarcerated. Next slide. So one form of consumer rights that's often ignored is the rights of long-term care consumers. And when I first started working in the field of aging, we referred to people who used long-term care services as patients or clients. But that's really changed, and today we refer to them as consumers. And the idea is that people who need care aren't just passive recipients, but they actively participate in choosing and directing their care. And it's great in concept, but I don't think we've really done a great job in defending the rights of consumers of long-term care. So what are consumers' rights? It's the right to multiple goods and services to choose from that are relatively safe. It's information to help people weigh their alternatives and identify false claims. It's also about government protections and regulations and enforcement of those regulations, and it's recourse when the protections aren't enforced. Next slide. Older crime victims also have rights that are often ignored. If I asked you what your rights are if you're arrested, I'm sure that a lot of you would know the answer. You have the right to remain silent. You have the right to an attorney. If you can't afford one, one would be provided to you. Even if you don't have direct experience with the criminal justice system, you probably know your rights from TV dramas and movies. These rights are also protected under the Constitution. But far fewer people know their rights if they're victims of crime. And it's understandable because victims didn't actually have rights until relatively recently. Victims' rights aren't included in the Constitution, and up until the 1970s, victims were viewed as little more than witnesses to the crimes committed against them. But the victims' rights movement of the 1970s really changed that. Victims' advocates, they tried to get a constitutional amendment, which they weren't able to do, but they were successful in getting victims' rights amendments into states' constitutions. And so most states now have them. So victims' rights include the right to be safe from offenders. That includes things like getting information about release dates so that they can make arrangements to stay safe. It includes restitution, getting back what offenders have taken from them. It's compensation for crime-related expenses. And it's the right to tell courts how they've been affected. And that's usually done through sentencing or parole proceedings. This is an area that's really been an area of priority for CEJC, the California Elder Justice Coalition. We've been working with our state to try to expand victim services for older people. And I think we've had some success. We've actually seen the state provide funding for many more victim services for older people. We've also tried to get the victim compensation for older victims of financial crimes who aren't eligible at this point. And we know that these victims have a lot of the same needs as older victims, as victims of violence. They may need mental health counseling or legal advocacy or even shelter or temporary housing. Unfortunately, we've introduced legislation a couple of times to allow for compensation for older victims of financial crimes, but we haven't been successful, at least yet, and we may keep trying. Next slide. People in jails and prisons lose a lot of their rights, but they retain some. One that we've been hearing a lot about these days is compassionate release. And compassionate release is a process for inmates to ask to be released early for extraordinary or compelling reasons. And that's usually for extreme medical conditions or when they're at the end of life. And it's become a lot more important today because we have so many older inmates. Just like the general population, the elderly prison population is the fastest growing segment of the population. And to some extent, to a great extent, that's from our three strikes laws with their very long mandatory sentences. And yet some inmates who could benefit from compassionate release, even those who are at risk for COVID, aren't eligible because they signed away their right to compassionate release in plea agreements. So that's an issue that I think is really being looked at today. Next slide. So here are some examples of ways to protect and defend individual rights. So if you think of it in terms of the prevention hierarchy, the best approach is primary prevention. I think a critical first step in primary prevention in defending individual rights is that we educate ourselves and others in our networks about what these rights are, and that we start recognizing the threats to them. So that can be done through public awareness campaigns or professional training. I'd really like to see multidisciplinary teams, which are used a lot in elder abuse, consider bringing more advocates on board, including consumer advocates or victims' rights advocates or disability rights advocates or even civil rights advocates. I think they could add a lot to the discussion. We also need to recognize threats to individual rights. And one of the really major ones is cognitive impairment. You know, we know that as we age, we're more likely to experience cognitive decline, which can prevent us from managing our finances or our care. So programs like daily money management or supported decision-making can help some people, but these programs are really in short supply. The cognitive decline can reach the point where we're not able to defend our rights and our wishes. And one way of ensuring in advance that we're able to protect our rights in the event of disability is through advance directives. But very few people actually have advance directives, particularly low-income people. We also need to make sure that first responders know that advance directives exist. And so that requires that we have registries and that people know about the registries. We also know that we also need to recognize when people are no longer able to protect their rights. And cognitive screenings can help, but they're really only part of the picture. We need to understand how cognitive problems relate to specific legal decisions, which is very complicated because different decisions require different cognitive skills. As you know, conservatorship may sometimes be needed for people who don't have advance directives or they don't have trusted family members or surrogates, and they're in serious danger. But conservatorship is also in short supply, and CEJC has been working with our partners to try to expand the availability of public guardians around the state and to expand training to public guardians. We also know that conservatorship can be overly restrictive, and we don't have a lot of good alternatives at this time. CEJC has been actually working with Congressman Ted Lieu of Los Angeles to try to get federal funds to help states improve their guardianship laws. And he was able to get $2 million into the budget for state working groups called WINGS. WINGS stands for Working Interdisciplinary Networks for Guardianship Stakeholders. And so far so good. That appropriation is still in the budget, so we've got our fingers crossed. Next slide. At the interpersonal level, elder justice is about abuses of power. So it's elder abuse in its various forms. It's domestic violence, where perpetrators use power and privilege to control their intimate partners. It's undue influence, which is when powerful people use unfair methods to try to get less powerful people to do things that go against their interests. Next slide. So how do we prevent or combat abuses of power? Well, here again, I think education is key. If we know who's at risk for elder abuse and undue influence, we can attempt to lower their risk, sometimes, not always. But epidemiologists tell us that the most significant risk factor for elder abuse is social isolation. So it's a good bet that we can reduce the risk of elder abuse by promoting social engagement. We can also do things like help families screen and hire caregivers and make sure that both caregivers and care receivers understand their responsibilities and expectations. I think we also need to do a much better job at holding professionals accountable. In the secondary column, I think we do have a lot of good tools for screening and detecting elder abuse and undue influence. They've been adapted for different kinds of elder abuse and for use in a variety of different settings. I think we've also devoted a lot of resources to tertiary prevention. We've made a lot of progress, for example, in prosecuting offenders and forensic centers, which essentially kind of fuel prosecution and provide other information to fuel legal interventions. Most of our protective service dollars also go to interventions, to investigations and crisis intervention, which are after the fact interventions. We're still lacking a lot of services for victims, including shelters. I'd really like to see more attention going to reducing the harm that abuse causes. I think popular culture would have us believe that the only thing that victims really want is to see their offenders prosecuted to the full extent of the law and to get the harshest sentences possible. But we know that a lot of older victims want other things. Many want to get back what they've lost and make sure that they're not going to lose more. When abuse is by family members, oftentimes victims want to see those family members get help, and that may mean treatment for substance abuse or for mental health problems or anger management. It might mean training for caregivers to help them provide better care. You know, one approach that's getting a lot of attention these days is restorative justice, which focuses on repairing relationships and the damage that crimes cause, not just to victims, but to their families or to offenders' families or even to whole communities. The Syracuse University is going to be holding a virtual conference next month where they're going to be talking about restorative justice in elder abuse, which I'm really looking forward to. A few communities have also developed elder courts, which give judges more flexibility in how they can help people in crafting solutions. Unfortunately, we don't have a lot of elder courts, and some that were in existence have actually been forced to stop. Next slide. At the community level, elder justice is making communities more accessible and safer and reducing disparities. Next slide. I think a great way to promote elder justice at this level, at the community level, is age-friendly communities. And this is an approach that was developed by the World Health Organization to combat barriers to things like transportation and housing, civic engagement, and protective services. And some people say that in a truly age-friendly community, we wouldn't even have elder abuse. I'm still having a little trouble getting my mind around that, but I think there's certainly a lot that we can do to prevent elder abuse just in how we plan our communities. Elder justice at the community level is also about reducing disparities within and between communities. And that includes disparities, for example, between rural and urban areas or between wealthy and impoverished communities. Those disparities might be in protective services and legal help and in resources and opportunities for independence. Now, CJC has been working on a project lately to map disparities between communities across the state in things like protective services and care in nursing homes. Excuse me. Equity within communities requires removing barriers that are faced by marginalized or disenfranchised groups. And I'm really a big proponent of community health workers. And community health workers are members of underserved communities who help build trust between their communities and the formal healthcare system. So they help people with things like managing chronic conditions like diabetes and hypertension. They provide health education and health literacy, and they advocate both for individuals and for whole communities. For some reason, community health workers haven't really caught on in the field of aging, which I think is unfortunate, especially as we're seeing today what happens when people don't trust the information that they're getting or who they're getting it from. Next slide. At the systems or societal level, elder justice is about public policy, regulation. It's also about culture change. Next slide. On the policy side, I think we need to make sure, for one basic thing we need to make sure of is that all of our laws that affect elders pass constitutional muster. Nina Cohn is a constitutional scholar that I interviewed for the book who's done some really fascinating work where she's looked at whether laws like our abuse reporting laws and our guardianship laws meet that basic threshold of contributing to the common good and whether or not they pay enough attention to due process and privacy. Like our colleagues who are working in the international arena, I think in America, we also need to get better at mainstreaming older people's interests into all policy that affects them. You know, on the flip side, though, I think we need to mainstream elder justice into aging policy and practice. I think elder justice sometimes tends to get left out of discussions about aging services, or they're kind of an afterthought. We've been working to try to bring elder justice principles into California's master plan for aging. And I know you're going to be hearing from Kevin Prindiville and some of his colleagues at Justice in Aging as part of this series. And they've really been doing a terrific job in highlighting elder justice issues. We're really pleased to be working with them on that. Some of the recommendations that we've made, for example, are to try to increase access to advanced directives, to create an Elder Justice Coordinating Council to oversee elder justice on an ongoing basis, and creating a WINGS program to review our conservatorship laws and see if we can come up with some better alternatives. So stay tuned on that. We also need to ensure that public policies are fair, that they don't disadvantage people that have already been disadvantaged. And when I ask students what they would do, one of the questions I ask them when we're talking about policy is what they do to preserve Medicare and Social Security. And the most common response I get is to raise the eligibility age, which I have to admit would work. But what I try to get them to consider is what raising the age means to someone whose life expectancy is 70 compared to someone who can expect to live another 15 years. And of those two, who needs these programs the most? But elder justice at the societal level isn't just about public policy. Another person that I interviewed was the former Assistant Secretary of Aging, Kathy Greenlee, who was really primarily responsible for implementing the Elder Justice Act. I asked her if she thought that it was time to expand on the Elder Justice Act to bring in more justice, to kind of expand the point of view. And her response was an emphatic no. It's the same response I got from other people who were involved in policy who pointed out the many pitfalls in trying to legislate elder justice. And Secretary Greenlee instead suggested that we try focusing on creating a culture of elder justice. And I agree, and I'm really pleased to see that some communities are now having anti-ageism campaigns, which I think is great. But as I noted earlier, I worry about falling into the trap of identity politics that divides rather than unites people and pits them against each other. And so I think we need to recognize that our movement can't just be about older people. It has to be about everyone who aspires to lead long and healthy lives, lives worth living. And that's going to require us to work with advocates from a wide range of issues, advocates for racial justice and women's rights and gender equity. I think we also need to urge advocates who work with those groups to pay more attention to their older constituents who often get left out. We also need to show them that doing so strengthens their cause as well as ours. I think that was Maggie Kuhn's vision, and I think Maggie Kuhn had it right. Next slide. Creating a culture of elder justice, I think, also requires that we reject really destructive generations at war narratives. I think part of the problem is that programs like Social Security and Medicare are usually seen as aging policy that only benefits older people and that protecting them is an aging issue. I used to remind my younger students that they had a lot more skin in the game than I did when it came to these programs, because my generation's benefits are more secure than theirs. Wouldn't it be great to see young people step up to advocate for Medicare and Social Security? I think it has to work both ways, though. We have to remind older people who have such tremendous political power that they have a tremendous stake in the success and prosperity of younger generations, and that includes immigrants. We know that 1/3 of long-term care workers are immigrants, and 1/4 of nursing home employees are immigrants. I think the language that we use to promote elder justice is really critical. The language of justice, of human rights, of fairness is really powerful. It resonates with people because it conjures up those values, those basic principles that we were raised with. It also gives us a common language that's understood anywhere in the world. The studies show that the public actually responds well to the language of elder justice, but we need to go beyond branding and messaging to give substance to the rhetoric. It's also not enough to just reject ageism and to reject elder abuse. I think we need to send out a positive message that's anchored in those fundamental ideals that we were raised with, yet reimagined to face today's challenges and opportunities. Clearly, one of the greatest challenges today is COVID. And I think in many ways, the COVID epidemic is a case study in elder justice. It exposed the structural ageism that made COVID so much worse for some than for others. It also posed challenges to individual rights, including the right of nursing home residents as consumers to basic safety protections, including adequate staff and infection control, and recourse for poor care. You may know that nursing home providers were calling for blanket immunity for COVID infections and deaths, and that included protections for bad actors who had long histories of providing substandard care. A lot of COVID clients were also denied the right to make critical decisions about their care because they didn't have advanced directives, or because those who were providing care to them didn't know that those directives existed, which meant that a lot of health professionals and first responders were put in this terrible position of having to make life and death decisions about people who they knew very little about. And I know it took a tremendous toll on some of them. I think COVID also revealed the challenges of protecting people from abuse during periods of crisis, like the epidemic, the lack of resources for adult protective services and for ombudsmen. But beyond that, the lack of understanding by government officials about the importance of these services in protecting people during emergencies. And so hopefully as we recover from COVID, we're not going to just focus on replenishing our public health stockpiles of ventilators and masks, but instead we need to rebuild our public health programs broadly in ways that promote health justice and equity and that empower marginalized groups. That includes programs like community health workers that focus on building trust. Without trust, we're never going to be able to do the contact tracing that's required or encourage people to get vaccines once they're available. Those are things that really require trust. I think we've also learned that we have a lot to do to ensure that vulnerable older people are included in disaster preparedness plans as we move forward. Next slide. So this last slide shows what it would look like if you combine the 4 levels of intervention with the 3 types of prevention and started filling in the interventions in each area. And these are just a few examples. I'm sure you could come up with many more, and I would encourage you to do so and to share them. I'd love to hear your thoughts. If all of us on this call and our colleagues mapped where we fall on the chart, I think we have a pretty good lay of the land of elder justice that shows where our resources are going and whether they match our values. As part of our work on the Master Plan on Aging, some of us at CEJC started talking to groups about what they'd like to see happen. We heard a lot of frustration from adult protective service workers who would like to focus more on prevention because they understand how hard it is to repair the damage that's been done once abuse has occurred. We also heard from legal aid attorneys that their agencies are doing less impact law, like class actions, focusing on instead on working with individuals. And I think that's fortunate, especially if you consider the impact of a case like Olmsted on millions and millions of people. So hopefully the model can also help us suggest ways to get involved as we move forward. I think now more than ever, we need our passion, all of our passion and all of our expertise to make elder justice about Nussbaum's right to life for everyone and Bhutan's pillars of happiness. It's striking the right balance between freedom and safety. Elder justice is ensuring that when we restrict rights, it's done as surgically as possible and with due process. It's about prioritizing interventions that do the greatest good for the greatest number of people and striking a balance between prevention and remediation. It's also about fairness between communities and within communities. It's reasonable accommodation under the ADA. It's consumer rights and victims' rights and the rights of inmates and those re-entering their communities. It's about mainstreaming elders into all of our public policies and following in the footsteps of Maggie Kuhn to align with other social.
Thank you, Lisa, for that amazing presentation. I was interested to hear about institutional ageism and consider how it affects things like the laws we work within daily. The framework of ageism as a compounder of other injustices brings depth to elder justice work. As you mentioned, cultural change and policy change are necessary components of elder justice. Our audience has many questions, all of which we hope to get answered in our Q&A. We have 15 minutes set aside for anything we don't get answered today, we will follow up with guests after the presentation. As a reminder, if you have any questions, please submit them into the Q&A icon at the bottom of your screen. If you have any questions, put them in the Q&A, and I'm going to invite Lisa back on. Folks, in order to see both of us on the screen, click on Speaker View in the top right corner of your screen. Hello, Lisa. Let's get to our first question. Let's see. Who is the ecological model of elder justice for? Is it just for professionals or anyone else?
Yeah, well, when I first started coming up with the idea, it was definitely focused on service providers. I'm a service provider, and my impetus was really to try to convey a sense or get people to think about their work as part of a broader network of elder justice. And as I mentioned earlier, when we started doing work on the master plan on aging and trying to bring more elder justice into the plan, we convened groups of people in the field. And one of the things that I think was noteworthy is that a lot of people that work in diverse areas, be it legal services or public conservators or administrators or people that work in case management programs, didn't necessarily see their role as being champions of elder justice, which was surprising to me, because to me, all of these things really are, can be captured under that heading. And so I think it's important for us to have this kind of combined sense of what we're doing and a value system in our work. So clearly for service providers, I also would hope that it's being used for people to help assess what they're doing as kind of a self-assessment tool, either for individual agencies or multidisciplinary teams or councils, or we have a lot of people out there that are looking at elder justice, and I think it gives them a framework, or it could give them a framework to see the different areas of elder justice and where provide some guidance to us and where we're doing better than in other areas. And of course, I'd love to see funders use the model to decide where we have gaps in services, where we're doing well and where we can use additional services, or researchers to help us figure out whether or not we're doing what we think we're doing.
And are there ways you could see using it as we recover from COVID?
Oh, absolutely. I think we had learned so many lessons from COVID, as I mentioned earlier, but I think one of the real overarching ones is the disparities. The disparities in people getting access to life-saving equipment. But I think what was particularly striking was the disparities in the pre-existing conditions and the factors that made people vulnerable to COVID in the first place. And I think that really gets down to the idea of the right to life for everybody, that I would see as an overarching principle of elder justice. And so as we recover from COVID, I'd really hope that we don't just spend all of our time and attention and resources on replenishing those stockpiles of PPE and ventilators, but we also think about those pre-existing factors and how we can try to protect populations. And as I said earlier, I'm really a proponent of community health workers because I think they play such an important part in building trust between communities that are underserved. And that's going to be so important if we're going to get people to accept vaccines once they're available. If you don't have trust, that's one of that's really going to be a stumbling point. So I think balancing those issues of equity in addition to tightening up our other public health resources.
How does your organization feel about Medicare for All as an avenue for healthcare justice?
Well, we haven't taken a position on that in particular, but I think, most of us are committed to the idea of social justice and health justice. And I think, we can there are obviously many ways to reach universal health care. I would imagine that most people in the elder justice arena, not just my organization, but others, have a sense of, the importance of equity between populations. How we get there is a political issue that I think will be discussed for years to come. And it always has been. Whether or not healthcare should be universal goes back many, many, and we have not really come to agreement on it, how it should be provided.
Thank you. So you encourage aging advocates to follow the Gray Panthers lead and get involved in the broader social justice movement. Do you have any suggestions for how to do that?
Well, yeah, as I mentioned earlier, even though the national office has closed, there are still very active chapters at the state and local level, which I would encourage people to look into. But I think it's also important, kind of in that spirit of mainstreaming, that we infiltrate, maybe that's kind of a sinister word, but that we become involved in other justice, social justice movements, and really try to raise awareness about the needs of older people. I think there's so many areas where older people's needs and interests just haven't been represented and reflected. Criminal justice reform is a great one as we rethink the role of law enforcement in our communities. It's something that I think we need to be looking at in elder abuse. Are we, as I mentioned earlier, are we asking too much of law enforcement, or are we asking not enough of them? And I think that's true in many other arenas, from women's rights to other areas of justice. How well are older members of different constituencies being served, and are their voices being heard?
Great. Let's see, we have a question about materials. Is there an available resource guide online that we can distribute out to case managers and other organizations specifically geared toward elder rights?
We do have some materials on CEJC's website, elderjusticecal.org. We've come up with a set of principles of elder justice that we have been distributing for exactly that purpose, to kind of stimulate discussion about how groups can think about elder rights, that talks about rights from the perspective of individual freedom to equity between populations. We also have a short video on perspectives of elder justice, and we have a lot more lengthy descriptions as well.
Thank you. And then you referenced the 1980s as a modern beginning for elder justice, which was modeled in part after justice for children and minors. What were the things that they did best during this time period, and what was the greatest failure? How could we learn from this today when thinking about the rights of elders or marginalized groups?
Yeah. Well, we definitely, going back to the late 70s and early 80s, we certainly have made progress. And I think one of the major contributions of the field is that we've simply, set a marker and said that this, exploitation and abuse of older people is not tolerated in our society. And that's, and we've been making headway in finding ways to protect older people ever since. I think, where our shortcomings are is that we haven't been critical enough of ourselves as a field. And going back to those early days, it was the federal government that first started talking about elder abuse and holding hearings around the country. But then they kind of lobbed it over to states to come up with their own response system for elder justice. And as you mentioned, patterned them after child abuse, which has some inherent conflicts in it. And I think we haven't really spend enough time thinking about what those conflicts are and really delving into them, like the issues of constitutionality. I think that, as I mentioned earlier, Nina Cohn is a constitutional scholar who's been looking at our reporting laws and our guardianship laws from a constitutional perspective, which is terrific. I think it should be required reading in our field, but it's coming at kind of a late point in our development. And also, when the idea of federalism in general is that, the states have an opportunity to develop their own systems. And that would have been great I think that was the thought behind Congress, giving this responsibility to states, with the idea that states were going to become, laboratories of innovation, and we'd find the best ways to serve older victims, and that those ideas would rise to the surface. But what actually happened is that, one state after another adopted the same system. And so we don't really have systems to compare with each other. There's only one state in the country, New York, that doesn't have mandatory abuse reporting. They have voluntary reporting, and a terrific system. Whether or not that's because it's voluntary or in spite of the fact that it's voluntary, we don't know. But it would be great to find out more about that. That's one of the reasons I'm really interested in looking at international initiatives to see how other countries have approached the issue, because some of them have actually rejected America's approach to elder justice and have tried different strategies. And so I think for us to really be honest and critical would really benefit our field.
Yes. And then during your presentation, you went back to our nation's constitutional founding to discuss elder law, which was wonderful. Do you find that people consider the rights of elders in a different way by presenting this contextual history?
Well, I would hope that it does. I would hope that it broadens our perspective and helps us think about our work in a historical context, where we fit in the social justice movement that's existed in this country for a couple of centuries. I think it also makes us better advocates. And the example I used earlier in the pandemic, the state administration was talking about cutting services for older people at home, home-based services like CBAS and MSSP as a way of making up for lost revenues lost from the pandemic. And many people made the argument that this didn't make sense because it would relegate more people to nursing homes where they'd be at greater risk of COVID, or it didn't make sense because it was more expensive. But if you can come in and say that relegating people to institutions is a violation of their rights under the Older Americans Act as established under Olmsted, that's powerful stuff. And so the Constitution is certainly a strong instrument that we should be taking advantage of. And I think we would be better advocates if we knew our history and knew our laws.
Lisa, it looks like that's about all the time we have for questions, but before I say goodbye to you, I did want to ask, do you have any final comments or thoughts that have come up for you that you'd want to add?
Well, I'm delighted to see that there's so much interest in this topic, and would love to hear from people to see how they're thinking about elder justice, and hope that we can all join in this conversation, both among ourselves, but also the broader social justice movement and its representatives. Thank you.
Thank you. With that, we're going to wrap it up for today's program and share a few reminders for everyone. So first off, thank you, Lisa, for your insightful presentation. We'd also like to thank our top sponsors at the Diamond level, Michael Stevens, Probate and Trust Realtor, and at the Platinum level, Campbell Green LLP, Trust and Estate Attorneys. Special thanks to our Silver level sponsors, Anderson, Yazdi, Huang, Minton, and Horn LLP, Fiduciary Accounting Services LLC, Mechanics Bank Wealth Management, Meredith Taylor IMT Associates, and our bronze level sponsors, 21st Century Care Solutions, ARM Homes, Center for Elder Independence, Golden Gate Fiduciary Services, Ingrid M. Evans, Evans Law Firm Incorporated, John Balquist Fiduciary Services, Law Offices of Sinroy G. Rousseau, Merlander Company, the Office of Supervisor Wilma Chan, Professional Fiduciary Association of California East Bay Chapter, and Ruth Stroop Farmers Insurance. Lisa's presentation and today's recordings will be available on the LAS website within the next week. If you need CEU credits, please look out for our post-event email in your inbox in the next 24 hours with further instructions. We welcome your feedback about the webinar so that we can continue improving the content we provide and on improving your experience. A link will be included in the post-event email. We invite you to sign up for the rest of our webinar series by visiting the LAS website at lashicap.org and going to events. Our next program is Justice and Aging Policy Update on Tuesday, September 22nd at 12 p.m. For any questions or comments about today's webinar or the program as a whole, you can email us at conference@lashicap.org. Thank you again for joining us today, and we wish you a great rest of your week.